Hello, everyone, and welcome to tonight's COVID-19 vaccine webinar. I'm Jeremy Guy, Assistant Commissioner for Communications at the Mid-American Conference. I'd like to take a moment to thank all the parents, student athletes, and members of the MAC on tonight's call for taking the opportunity to learn more about COVID-19 vaccines. We have a great panel of doctors lined up for you this evening, but before we bring them on, I'd like to introduce Commissioner of the Mid-American Conference, Dr. John Steinbrecher, who would like to say a few words. Commissioner, you may go ahead.
Thanks, Jeremy, and a good evening to everyone. And thank you so much for joining us this evening. To our special guests and panelists tonight, we appreciate you taking the time to come and share your expertise and knowledge with our group of folks. Truly appreciate it. To our parents and student athletes, gosh, what a year it's been. Who would have ever expected the things we've gone through and how we've managed it in the past year. In our case, last summer, our league developed a medical advisory group that was comprised of doctors, medical advisors from each of our member institutions, as well as we had a public health official join us. And we were meeting on basically a weekly basis for the better part of the summer and fall, it seemed like, as we were trying to ascertain whether or not we could, in fact, begin practice, begin competition. And if we could do that, what are the protocols we needed to follow? Our group stayed in close communication and followed feedback and guidance from the NCAA's COVID-19 panel, which was a national group of medical advisors, from the CDC, as well as state and local health officials that continue to guide us and give us information and give us advice as we continue to work through our seasons. Well, what does the future look like for us? You know, that's the $100 question in front of us, and maybe our panelists will have better answers than I have right now, because I think it's a story still to be written. And it's a story that will be written. I've said for the better part of the year, the virus will dictate our actions. But I think we're also getting to a point where our actions are going to dictate a little bit the viability of the virus. And so whether it's social distancing, masking, good hygiene, vaccines, all of that is going to play a role in how we operate in the months to come and as we go into next fall. And whether that means we can open our stadiums with no restrictions, or we're limited in the numbers we can put in. Can we be playing our games? I expect we could, but what does that mean in terms of how we format our practices? What does it mean in terms of testing protocols? All of those sorts of things will be dictated on the things that occur in the months ahead. Do we get to a certain level of people vaccinated? Do we get to certain positivity rates within our various communities and states? All of those things will play a role, so all of our actions together will guide that. And so I hope if you haven't been vaccinated yet, that you will strongly consider it. If you have questions about it, I hope that we are able to answer some of those questions tonight, and that you will continue to use us as a resource, and that we can continue to put you in contact with the experts in the field. And so again, thank you for being with us tonight. Thank you for participating and being a part of the Mid-American Conference. It's a great league. We have great student athletes and coaches and member institutions, and I hope you have a marvelous experience. So again, we welcome you this evening. Jeremy, let me kick it back to you.
All right. Thank you, Commissioner. And now we'd like to introduce tonight's panel. We're very excited to be joined by three doctors. Two from our partners at the Cleveland Clinic and one from our member institution. All three of tonight's panelists have been on the front lines of COVID-19 since the pandemic began. First, Dr. Sumita Khatri. Dr. Khatri is a professor of medicine and pulmonary and critical care medicine specialist at the Cleveland Clinic. Dr. Khatri serves as the director of Cleveland Clinic's Asthma Center and vice chair of the Respiratory Institute. Her research and advocacy roles range from air pollution and health, equitable healthcare, and addressing viral illness and pandemic response. Since the beginning of the pandemic, she's been helping care for and coordinating care for people with COVID. Dr. Marie Schaefer. Dr. Schaefer is a sports medicine physician at the Cleveland Clinic. She's the Associate Director of the Sports Medicine Primary Care Fellowship Program and the Associate Director for Education and Community Engagement for the Sports Medicine Division. In addition to her regular clinical care, she is the head team physician and NCA healthcare administrator for Cleveland State University. Dr. Jennifer Tchaikovsky. Dr. Trpkovski joined Central Michigan University in November of 2018. She is an assistant professor of family medicine and sports medicine at the CMU College of Medicine. She serves as head team physician and medical director for CMU Department of Intercollegiate Athletics. Dr. Tchaikovsky also serves as a member of the MAC Medical Advisory Group. Before we begin the presentation, just a quick note. If you do have any questions at any time, please click the Q&A button below and submit your question via text. We'll get to as many of those questions as we can once the presentation is finished. With that, I'd like to bring on and welcome Dr. Khatri. Take it away.
Thank you, Jeremy. And Commissioner, spoken like a true coach. This is going to be a team sport, as you know, and I think the world is coming together to try and fight this. And nothing like motivation for a new day. We will be writing this story together. I'm very pleased to be presenting today and hosting this town hall with Dr. Schaefer and Dr. Trpkovsky. I know they have your best interest at heart, and so do I. So I thought that we should start with just a few framing slides where we can go over some of the basic information that you may have all heard here and there from the news and from your own sources. But I thought it might be nice for us to begin with on the same playing field. So just going over where are we now and why the vaccine gives us hope, and then we'll get to your questions. So why do we have a COVID pandemic? There are times when I wake up and I'm like, am I dreaming? Was that a bad dream? Well, it's a very long dream. We know that the first cases were in China in December, but there's some evidence that it might have been as early as October. In the US, we had our first documented case in March, but perhaps it was actually much earlier. Was it perhaps January? We know that it's very contagious and it's an invisible threat. We know people can have no symptoms but still be contagious. The other threat is that you can have an incubation period and not even realize you're ill and exposing others, and it takes time to get sick after this exposure. None of this is new news at this point. We know all this. But I think what we're facing now is that the virus is so smart, it wants to live on forever. It really does, and use us as their hosts. And it changes and adapts to become stronger. And most importantly, it is more deadly than the flu. And if you look at the picture on the right on top, you can see how many deaths there were earlier on in the year, in January 2021, throughout the year. Obviously, the hot red is hotter, where there's more deaths. And look where we are now below April 24th. We are still hot in several places. We're orange in the US, and we know what's happening globally now. Other citizens of the world are suffering a really difficult fate. Every day is different. So I took this data from the 24th. And when you look at the top slide, you can see where we were. These are the spikes in daily new COVID cases. Initially, as you see, we were okay. And then around March, when it first started coming, we saw that initial spike. Everyone was worried. We were actually even building a surge hospital here, and it sort of stopped, so, or at least plateaued. Then the second wave happened around July 4th holiday. People were outside, but people gathered, and that sort of started a new spike. And then we ended up with a new plateau. And then, of course, the holiday season, everybody had warned us, and we were like, no, we're going to be okay. But here we are with this huge, huge spike over the holiday season into the early 2021 year. And we have still not gone down lower than where we were around July 4th. So we're not out of the woods just yet. So there are now 32 million confirmed cases, and that is 10% of the US population. And it's likely underestimated because probably there are people who have COVID that haven't been tested, so it's likely underreported. Last I checked, 572,000 deaths or so, and we have heard that probably after the first 100,000, this was preventable. COVID, the death rate is 1.8% of cases, and that is, just for context, about 30 times that of the flu. So people say it's just like the flu. It is not just like the flu, and it's important that we're real about this. So we talked about how the virus is very smart. I mean, it's amazing how this little organism that you can't even see can outsmart all of us. And there is a lot of variant activity. You've heard about the B117 variant, and many of the new cases that we're having in the US are this variant now. And look at where our Mid-America conference is. The darker blue are the areas where there's higher levels of variant activity. And I was talking to your commissioners and your coaches, and I realized you're not flying, you're actually driving to these tournaments that you're going to be going to, and you're in your own bubbles at your own institutions. But you're going to have to stop and get some coffee, you're going to have to stop and go to the restroom. So you'll be traveling through states in which there is high variant activity. You need to create a shield around yourselves, and that can be done with getting vaccinated. So why, we're worrying about, well, will the variants be covered by the current vaccinations? What can we do? Will I need booster shots? These are all very, very fair questions. But what we do now know is that getting a vaccine is significantly more protective than not getting the vaccine, because these viruses change and mutate all the time. Think back to your biology courses, even in high school, that every time a virus makes a copy of itself, it can switch to be smarter. It can start spreading more easily. It can cause more severe disease, and it can resist the body's ability to fight them off, whether you're vaccinated or not. So when you're in small groups or in larger groups where you don't know who's vaccinated and who's not, if you are vaccinated, then you are less likely to be a Trojan horse, I like to call it. You don't want a virus to come into you, and even if you're not sick, but you're carrying it to a certain degree, you don't want to give it to other people, because then the virus knows that it has a substrate, they have food and shelter, and they're going to create more and more virus copies to infect other people. And that's the only way we're going to be able to stop the variants, is by stopping the spread, by becoming vaccinated. And if there's some reason you can't get vaccinated, and this is a conversation with you and your physician and healthcare provider and coaches, you have to also take very, very strict precautions on social distancing. So how does the vaccine work? Well, vaccinations have been in the news quite a bit, and I'm always thankful that the reporting is so timely and quick. But I'll be honest with you, it's a lot of information coming to us all at the same time, and it's hard to keep up. So I thought I'd go over some of the very basics. I really appreciate this cartoon because it helps me describe to you how the virus spreads. As you can see, in the middle of this slide, at the very top, is the very famous now coronavirus. We now know why it's called corona, because it looks like a crown, and so it's hard to miss anywhere. So you can see that this person on the left side of the screen, she is breathing in air, which contains virus particles. As she breathes it in, this virus is particularly attracted to the respiratory cells. This is why it's a respiratory virus and a respiratory transmissible virus. Once it enters the cells of the lung, it starts to, it goes in, I should mention, that spike protein, that thing that looks like one of those chicken lollipops that's sticking out? That's actually like a key, like a master key to the lock of all of your cells. So it goes and it attaches to that ACE receptor, that little yellow paddle looking thing, and basically comes in and invades and enters the machinery of your cell, and uses it and uses the blueprint that it brings in to make more and more viruses of itself. It doesn't help you in any way. It decides to help herself, maybe both. And then is released, more viruses are released after destroying that cell. And in an ideal situation, what you have on the right side is that your immunity fights it. Sometimes the immunity is overwhelmed and you can't fight it off fully. But there's also some memory that occurs, which is why people say, oh, I wanted to check my antibodies to see if I'm immune. But we don't know how long that lasts. So this is all still emerging knowledge. But I just wanted to explain to you how the virus acts. So I'm going to just highlight 4 vaccinations that are available. One is not available in the United States. That's the AstraZeneca Oxford virus, but I included it because it's similar to the J&J virus. So there are 2 types of vaccinations that we're using here in the United States, the Pfizer vaccine and the Moderna vaccine, which are still available to us. And these are DNA and RNA virus particles that come in. So what they do is they've created little lipid vesicles, so little fat balls in which the code, the blueprint of that spike protein, that little chicken lollipop, that spike protein that recipe's in there. So once that enters into your cell, that lipid, that fat ball sort of disintegrates, and then that very recipe goes into the machinery of your cells and creates that spike protein, which the body has likely not seen before. In so doing, it creates an immune response so that when the actual spike protein comes to your doorstep or into your lungs, you are able to create an immune response to block it from causing infection or severe disease. And we know that that is actually working based on the studies. On the right side, the green arrow means that the J&J is available to us again. There was a pause about this, and we'll talk about this here in just a little bit. But the J&J vaccine works by using inactivated virus. So the viruses are available that you can basically knock out its ability to duplicate itself. But you can use it as a vehicle, like a space shuttle capsule or something. Inside that virus particle that cannot replicate itself in your body, you insert, again, that little genetic code that once it enters the cells in your body and infects it, or at least takes it over, just that cell, that it can start making more of the protein of that spike protein. I mean, we're kind of lucky in a way that it's a spike protein type of virus, because that's something you can really try and create so that you have an immunity. The other good news, I should say, about actually the viruses, the mRNA viruses, the Pfizer and Moderna, is that as variants occur, the science is so good that within 30 days, you can create a new vaccination that is able to address a significantly different genome. So we're very fortunate that science really came together to create this and really start saving us from this virus. So I really feel like this is where the ray of hope began. You are probably so familiar with Pfizer and Moderna now because it's been out there, but Pfizer is 2 shots 3 weeks apart. Moderna is 2 shots at least 4 weeks apart. They both need to be frozen, and that's a bit of an inconvenience because it's sort of hard to ship it out, but that's why these mass vaccination sites and hospital systems are available. And they are about 95% protective from active infection. Now, more vaccinations, as I mentioned, the adenovirus vector vehicle does not multiply. Again, let me just say that it does not multiply, but it brings in a part of the COVID virus that the person can have immunity to. So the J&J virus vaccine is a single dose. It's through that viral vector. And the good news is you don't need a special freezer for it. So for people who may not have access or ability to travel to these mass vaccination or hospitalization sites, that this is available for them. It is also protective against multiple variants, and overall, it's about 66% protective. And I know people were like, this doesn't seem all that exciting. Well, actually, what's more exciting than the 66% is in more than 85%, so almost 90%, it was protective in moderate to severe disease. So the type of illness that would get you hospitalized was prevented in more than 85% of individuals, which might explain why the pause occurred and why the pause lifted. The pause was lifted on holding on the J&J vaccine on the 23rd. But let me explain why the pause occurred. There was a signal that was noted that about 6 people out of 8 million vaccinated had what's called this cerebral sinus thrombosis, and I'll go over that in just a second. And 15 people had other unusual clotting. So that rate was about 7 per 1 million women, and usually in the age range of 18 to 49 years old. Because of the thoughtfulness and the caution that we are having in place as public health individuals, the CDC, the FDA, et cetera, that there was a very, very aggressive safety net, a safety review. People were watching about what was happening. And so even patients, physicians, scientists could report. And they saw that this was happening. And that's why there was a pause to say, you know, this is a little bit more than what the general population would be experiencing. So why don't we take a look at it? So that's why this vaccine adverse event reporting system actually worked. It worked quickly. And again, based on what I just mentioned, which is that how effective it is for severe disease, it was felt to be that the benefit significantly outweighed any risk from this pattern that was being noted, but that doesn't mean that they have stopped examining them. So just so you understand, the one that keeps coming up in our in the news is the cerebral venous sinus thrombosis, and also called thrombotic thrombocytopenia, which means that you can have platelets that are low, and you would think when your platelets are low that you'd bleed more. In fact, those platelets aren't effective and you actually clot more. And they're not exactly sure why that's happening, but because they were noted, the CDC has alerted everybody so that we are watching for symptoms of headache with or without vomiting, changes in vision. And in fact, this venous sinus is part of the veins of the brain, so that when the blood actually is done, the arterial blood goes to the brain and then the venous blood drains the brain. That's where the clot seems to be occurring. So the treatment is also unique. You can't give them blood thinners for the clot. So what I'm trying to really impress upon you is not to be sort of nerdy about the science, but really more to be very careful that I'm being as clear as I can, that everyone's watching this carefully, everyone knows to look for it, and vaccinations still remain the most important thing we can do. And good news, I'm guessing all of you are over 16 years old. All of the states that you're studying in have vaccinations available for you more than 16 years old. So back to the mutations, we talked about the B117 strain. And what is a strain? Mutation is a change of the genetic code. A strain is how a virus acts significantly different than any other type. So it's almost like a zebra compared to a horse. It knows that it's been wily and smart and become more contagious, can make you sicker, it can attack a different age group. So this B117 is no joke, and it's here. So we have to really protect ourselves. And are we protecting ourselves? I think that the older generations, you know, the people 65 and over, or even 50 and over, definitely 65 and over, they were sitting home watching the news, wishing they could hug their grandchildren. How many of us haven't seen our parents because they're far away, or our grandparents, and all those very touching scenes of people through the window? I think all of us have experienced that. So our senior citizens have looked for this opportunity, and they ran out and got this as soon as they can. But look at you, look at us in the Mid-America Conference, right? How many are you getting vaccinated? In your age group, the latest data is that only 16% of people ages 18 to 29 have been fully vaccinated. Good news, 30% have gotten 1 dose, but don't stop at 1. That doesn't give you the full immunity that it needs to. My girls are 17 years old. They signed up the day they could sign up because they knew that we weren't going to let them do anything unless they did. But it wasn't browbeating. They wanted to really resume a normalcy to their lives. And yeah, they had side effects, but we knew that the immunization was working. So if there's anything I can really leave you with is please protect yourself. Don't be left behind, because as you can see in this colorful graph, that the red is the number of hospitalizations in older people over time from the beginning of the pandemic, but the blue are the people in your age group, 18 to 29. So being hospitalized really won't allow you to play sports. So I just wanted to leave you with the thought that we are all in this together. You're relying on us, the doctors, to tell it to you straight, and we're relying on you to do the best you can to protect the world. So with that, I'll turn it back to you, Jeremy.
Thank you very much, Dr. Khatri. And next, we're going to hear from Dr. Jennifer Tchaikovsky. You are live.
Thank you, Jeremy, and thank you, Dr. Khatri, for that wonderful presentation. Really appreciate the background, sharing that with our group. It's very important, I think, to understand how these vaccines came about, why they were approved, and that they're safe and effective. And I think our goal from the group of panelists is to educate this group and answer all your questions. So please find the question and answer portion and ask your questions, because we're here to just answer those questions and educate you and make sure that you have all the information that you could possibly have and more to make an educated decision on whether to receive the vaccine or not. So I will just say briefly, in addition to what Dr. Khatri discussed with the vaccine. So as we know, the Johnson & Johnson's back on the market, and that's 1 shot, 1 dose, 1 and done. And we definitely advise any of these 3 vaccines that has been put back on the market and shown very, very slight risk of having that special kind of clot. And we know how to treat it now. The problems in the beginning were they were suspecting it was just a standard type of blood clot like you can get with birth control risk or pregnancy risk. And that's not the type of clot that it was found to be. So those were some of the complications that came about. So I think it's important to understand that background a little bit, that it's not the same type of clot. And if you're on birth control, you're at risk for different types of clots, which are actually even more common than this one was. So we're ahead of the game on that. We know what to ask now if you were given this type of vaccine, and know what to look for, and educate those who were vaccinated with Johnson & Johnson to make sure that they look out for these signs and symptoms. So I think we're in a much better place with that one, and I think that's safe and appropriate option. Also for the Pfizer Moderna, so that is 2 shots. We do recommend both for the max amount of protection from that. We realize that there is going to be maybe some issues on your campus if you get the first dose. What do you do about the second dose if you're going home? So we do encourage you to contact your local health department or the local mayor, whatever's in your area providing the vaccine, and ask them that you had the first dose on your college campus. Can you get the second dose in the city that you're in at that point in time? So those opportunities should be there. From what we understand, that should be pretty readily available to you. And we do encourage getting that second dose on time and not waiting until you return back to campus. So those are just a couple of points I wanted to mention on the vaccines themselves. I really just want to share with you all that there definitely is a light at the end of the tunnel. As Dr. Khatri had mentioned, unfortunately, the hospitalizations are falling into the younger population, but the kind of light on that side is that we're seeing that the vaccine is working. We can deduce that, hey, our nursing home patients aren't dying easily anymore. Elderly patients are not being hospitalized, and they were the first ones vaccinated. So this is an excellent sign. And the fact that we can slow this down in those populations really shows us that if the other age groups come up to the numbers and can get vaccinated 70+%, we can really stop this thing in our tracks. And there wasn't a point in time that any of us physicians thought we would see this day this soon. So this is a great sign, and we just encourage you again, ask the questions, make an educated decision based on what you're comfortable with information presented to you that you've investigated. If you've heard something that sounds like it might be a myth or something that scares you, ask us now or search other sources. If you see it just on social media, probably not the best place to take it for its word. So again, thank you to the MAC. We really appreciate this opportunity to be here and just share this information with you all. That's what we're here to do. So ask your questions. I can't say that enough. We really want you to use this time and get that information from us. And we are here definitely just to help support you. We care so much about our student athletes and keeping everybody safe. If we want to get back to normalcy, we want to get away from having to test 3+ times a week, having to be masked in our sports. This is the opportunity. If we are not vaccinated, there is little chance that we will move out from those restrictions. We had a great breaking news today from the CDC that vaccinated individuals, they don't have to be masked outdoors unless they're in crowded spaces still. So the organizations are following the data, continuing to follow the science. So things will change and those regulations will change. And that's because we're continuing to study this, we're continuing to evaluate our situations and scenarios, and then hopefully local and state authorities follow that. Then the NCA follows that. Then the MAC follows that in our conferences. So we really are looking at updating those restrictions, but it all is based on vaccination. So I'm telling you, this is the way to go forward for normalcy. And we can see that we can get there based on the numbers and data we're seeing in the elderly population. So please consider it, ask the questions. We're here, and I'll let Jeremy take it from here and we'll get to your questions. So thank you all for your time.
Thank you, Dr. Trpkovsky. And Dr. Schaefer, anything before questions that you would like to add?
Yeah, thank you so much for having me at this panel this evening. And I just, as a putting on my hat as a team physician, I really want to echo Dr. Trpkovsky's statements about getting back to normalcy. And this is the way to do it. And I never again, as a doctor, do I want to be involved with treating an infectious disease that we don't know about and that continues to change, and we have to learn how to treat it in front of us. And I cannot believe how quickly we as scientists, we as doctors, we as a community, we as student athletes have been able to get back so many things that we had taken away from us. And I'm very excited about the promises that this vaccine holds. And I'm certainly encouraging all my young athletes to get this vaccine as well.
Okay, great. Good news is we have had some questions submitted. This first one is for you, Dr. Tchaikovsky. The question is, if I had COVID, do we know how long natural immunity lasts?
Thank you. So for the actual COVID disease, once you have that, your body responds by developing antibodies. That's how the vaccines work as well. The thing with the natural immunity, we call it, when you're infected with the actual virus, is there are people that have been shown to only have 2 weeks of antibody to this, and some individuals can have 3 months or more of antibody to this. It's very individualized, and unfortunately, it's not permanent, and it doesn't seem to be more than that time period of 3 to 6 months. So that is why that natural immunity unfortunately isn't enough to keep you protected for a long enough period of time from getting COVID again. So you certainly can get sick and get ill with the same virus, especially with the mutations, again, within the same year of having the COVID illness initially, because the natural immunity can be weeks to a short amount of months.
Thank you. This next one, Dr. Schaefer, this one's for you. Of the 3 vaccines approved for use, is one better?
Great question. The short answer is, of all the 3 vaccines offered, my choice is get a vaccine. And the reason I say that is the whole point of getting the vaccines, as we've reiterated time again here, is that we're trying to prevent COVID-19 infection, transmission, and severe cases of COVID-19. And each of those vaccines that are on the market today can do that. And every vaccine available is better and effective than no vaccine at all. And remember the point that Dr. Khatri made in her presentation as well, that even if you get infected with COVID-19 after having the vaccination, you're much less likely to have any severe cases of COVID-19. And as the other team physicians especially can attest to, and Dr. Khatri as well, young people still do get severe cases of COVID-19. I have at least 2 athletes that, one of which I do not think will be able to participate in Division I athletics anymore because of her experience with COVID-19. So the message is they're all a little different. They, whatever one works into your lifestyle and what is offered to you is the one that I would recommend getting.
Okay. Dr. Khatri, explain what EUA status means concerning the vaccines.
EUA actually stands for Emergency Use Authorization. It's a special provision that the Food and Drug Administration, the FDA, has come up with in the case of a significant emergency, and that's COVID. And a new product can be used, and that's the vaccinations that have been proposed. But it also needs to have provisions where it's serious and life-threatening, and we know that there's some evidence of effectiveness in which the risk of the disease versus the benefit of the intervention is in a favorable spot, that the benefit of something new is likely to be helpful. And also that there are no alternatives. So we've seen the vaccinations come through EUA as well as certain medications. And when this natural disaster is over, enough that it's not an emergency, the obligation for all of these companies is to go for FDA approval after that. But I'm glad that there's a little safety hatch, that we had to get this. Otherwise, it would have taken a long time. So that's what an EUA is.
And Dr. Khatri, another question for you. Okay. Should we be concerned about safety with the quick rollout of the vaccines in general?
That's a very good question. And when I was not aware of how they were going to do this, when Operation Warp Speed started, I had the very same question. Now, I've been doing some clinical research in my career too. And I understand that when there's something new on the horizon by companies, like medical companies, that they have to come up with an idea. Then they have to get a lot of venture capital and fundraising to at least start the idea and check them in healthy volunteers. And after enough healthy volunteers or first animal models, then healthy volunteers, and then people who get it in a trial, the vaccine, whether they get that or placebo, and see who ends up getting infected. So everything's in sequence. However, because everyone was working together, the world came together, the genome was discovered, people who were enemies as far as competitors go, worked together to do this quickly. And so after they would get enough information about animal studies, and they felt confident, because they were able to enroll a lot of areas were able to study it. Then the next phase, looking at healthy volunteers, when they were able to enroll enough, and they saw that it was like a relay race. It was like multiple races around a track that was staggered, but with definitely enough people and participants where safety and efficacy was never a question. So it's really one of those feel-good things that the world can work together. I just wish we'd always remember that. So I have no concerns. I have zero concerns about the speed in which it happened. And I'm just grateful and thankful that we were able to do this carefully, thoughtfully, and expeditiously.
Great. Next question is for you, Dr. Trpkovsky. For an individual who tested positive earlier this school year, do you suggest to get the vaccine, and if so, why?
Great question. And yes, definitely recommend still getting the vaccine. And the reason for that is because of kind of what I alluded to earlier with the natural immunity that will wane. So in the vaccine, we know minimally from recent studies that at 6 months, we still are showing great antibody response to the vaccine, which is incredible and a great finding. So we were very happy to hear that. And you say, oh man, 6 months, that's not that long. We wished it was longer. Well, we only know 6 months. This is new. So we have to continue studying it to see how long that immunity will take us. We're not sure at this point in time yet if we will need boosters, and we're going to go into probably some additional questions about that. But I will say, if you had COVID, you still want to get vaccinated because your natural immunity does not likely last as long as the vaccine immunity does. And so it's very important to continue to protect yourself. And on top of that, there is recent literature and studies that demonstrate those who are long haulers. So these unfortunate individuals who are left with, and if there's athletes on here who've had it, they know shortness of breath. They can't compete at the level they used to without getting winded or having chest symptoms or coughs or this chronic fatigue. That's what we're seeing in athletes, are the performance being hindered after COVID just based on the sheer fatigue and inability to breathe at the level that they used to. This vaccine is actually shown to improve symptoms in those long haulers. And that has been incredible because we, as a medical society, have been at a loss on what to do with these long haulers. There are now rehab facilities opening up and more being done to study it, but we keep learning every day what this virus can do. And this has been a great piece of literature that's come out to show us that it actually can help improve those symptoms. So yes, if you had COVID, get vaccinated. You should wait till you're feeling better before you get the vaccine, but definitely it's recommended even if you had a recent COVID infection.
Dr. Trpkovsky, another question for you, and I see this pop up a few times actually, but as a female, should one be concerned about fertility or pregnancy concerns, in the future?
Thank you, Jeremy. I'm so glad someone asked that question, because if not, I was going to address it anyway, because I think this is so important. This has been a very high topic discussion from my athletes and also from my colleagues, and even myself as a young professional. I don't have any children. I did get fully vaccinated knowing this was out there circulating because I trust the data and the science, and there is absolutely zero data or science to make any of us believe that this affects fertility whatsoever. So I would say, no, this is not shown to affect fertility. I'll address that one first and foremost before pregnancy, but with the fertility, we are seeing that even our organizations like the American College of Obstetricians and Gynecologists, the Reproductive Medicine, the Society of Fetal Maternal, so baby and mother, they are all recommending that the vaccine should be offered to these individuals, and that there's no scientific evidence to show that fertility is affected. And interestingly enough, so pregnancy was an exclusion in the beginning studies, which means that Pfizer, when they were studying, and Moderna as well, they weren't studying pregnant population initially. So just on the Pfizer end of the studies, they would do a pregnancy test to make sure that a woman wasn't pregnant upon entering the study. Well, they collect all this data during the study, and actually 23 women became pregnant in the time that they were enrolled in the studies. Interestingly enough, 12 of those were in the COVID vaccine group and 11 were in the placebo group. Placebo means you got a shot, but you actually didn't get the vaccine. So that shows it's a small number, but nonetheless, we've since then had millions and millions of people vaccinated, and there has been no demonstration in the adverse events through any of our colleges that show that fertility has decreased in the population whatsoever. So very promising. Animal studies did not show any issues with fertility. All of these lead us to point to the direction of we absolutely feel comfortable recommending it to women in their pre-reproductive age who want children, but also our men, our males are concerned about this too. So maybe the focus has been on the females, which isn't completely fair because we have young males who want to have children. And it's important to also note that the male reproductive societies have also said, do not withhold vaccine from those desiring fertility. It's really important that individuals are vaccinated across the board is what we're finding. To the pregnancy. So obviously that's a more sensitive subject. You are caring for this baby and that's your priority. And you really want to make sure you're protecting this. I could understand that. So it's definitely a decision that's between you and your education of the questions that you can get answered. But all of the organizations, again, are recommending that this is likely going to come out and be safe in pregnancy. Like I said, those women that became pregnant during the initial studies, the outcomes did not show any difference between the regular population. Pregnancy is being studied currently. Everything from the data they're having up to this point, they released some of that in March, and they showed that nothing pre-pandemic wise shows any dangers of like miscarriages or stillbirths or any of that increase in pregnancy compared to pre-pandemic numbers. So again, all very promising data. And most of all, COVID is a horrible disease. It is, for us that have been on the front lines and have seen it, or those have lost loved ones from it, no, it is the worst of the worst that we have seen in this country in most of our lifetimes. And pregnancy is a higher risk category, meaning that if you are pregnant and you get COVID, we know that is a higher risk of death, hospitalization, ICU admission, ventilation, and preterm labor, which means going into labor prior to the time that that fetus is fully developed. So nothing is showing that that risk benefit is to not get the vaccine. It definitely is showing that it's more of a benefit to get the vaccine. So if you're pregnant, I encourage you to have that discussion with your doctor and make the best decision that you think is right for you.
Thank you. Next, Dr. Schaefer. Will an annual booster shot be needed similar to the flu?
Great question. And the answer to that is it's not completely clear yet if we're going to need COVID booster shots. There's a possibility that some type of COVID booster will end up being the norm. Whether it would be every year, just like the flu shot, is yet to be determined. And part of the reason for this is that the researchers and the research is not yet completed to know how long the protection from the vaccinations lasts. And, you know, that's where you talk about the variability between the different vaccines. And those studies are currently ongoing. Some of the recent kind of postulations out there is you may need a booster shot about 12 months after the initial dose. But right now they have people, the National Institute of Health has people enrolled in these types of studies to determine that question. And Dr. Khatri can correct me if I'm wrong, but the COVID-19 and the coronavirus does not seem to mutate quite as quickly as the flu does. Yes, we're getting these different variants in. But the mutations seem to be at slightly a slower rate. So that's why we have to get an annual dose or an annual booster of our flu shot, is because it mutates so quickly that we need to catch those new variants and those new strains. And that's yet to be determined with the COVID-19 vaccine. So it very well may be that you don't need a booster every year, but you'll need it every 3 years. But that information is certainly still in the works.
We have another question for you, Dr. Khatri. That question is, does the vaccine affect my immune system's ability to fight off other diseases?
That's the beauty of our bodies, that as we are born, we adopt our mother's immunity. So our mom passes on our immunity. But then we are left to our own devices to create immunity to everything around us, which is why we have infant and childhood vaccinations to help us. Otherwise, we knew that early death as a child was there until vaccinations occurred. So death and disability did occur without vaccinations. But the great part about all of this is that all of us are encountering germs every day. We're encountering small bacteria every day. We have immunity to it. And it's only those viruses that we know that we may not encounter and are at risk of, like smallpox, right? The vaccination helped that as well. So we are so robust as human beings, unless we have an immune problem, we are able to put on the armor for multiple threats throughout our lifetime.
All right, and Dr. Tchaikovsky kind of touched on this before, but so you can reiterate, do we know or have an idea of the window of protection for these vaccines?
Yes, so we don't know exactly how long we have antibodies after the vaccine. So like I mentioned earlier, we have been studying this, and we know that at 6 months, based on Moderna and Pfizer studies, that we still have great immune response to the virus at that point in time. So we know minimally 6 months right now is a definite time frame of which we will still have immunity and antibodies, most likely. They're going to continue to look at this because, again, this is new and this is new information. So because we don't have a year's worth of vaccine yet, we don't know a year's worth of data yet. So unfortunately, that time is going to have to continue to be monitored. So we're not going to know that answer right away because it's, again, such a new technology of being implemented in this most recent month. So it's going to be a while before we know exactly how much immunity we have from the vaccine.
Thank you. And I'll just leave it, I guess. That's the questions that were submitted. I didn't know, leave it to any of you for a parting word or anything you'd want to leave us with. And since you're kind of on the screen here, Dr. Trpkovsky, if there's anything you want to leave people with here, that'd be great. And we'll kind of go around the horn and wrap things up.
Sounds great. Again, thank you everyone for all your attention. Thank you so much, Dr. Khatri and Dr. Schaefer, for being here with us today. And thank you for the MAC that recognizing education and focus on our athletes and our support with our parents, and the whole conference is super important. We want to be here to support you. So I'm glad everybody asked questions. And I just want to say this is the hope for the future. The future looks bright, and we can have superpowers. We can help stop this virus in its tracks. The sooner we get vaccinated, the quicker we'll stop variants from exponentially affecting our population. And then hopefully we won't need boosters because we did it. We stepped up, we got vaccinated, we trusted the science. And again, if you have concerns about that, share them with a doctor, share them with your physician, share them with someone, and seek out that information. Don't just take one source for its word. Look around, even with the science. You can continue to investigate and find other avenues to research and make sure you feel confident with your decision. We're here to support you and support that. But it's very exciting that we have a tool now to get back to a normal life and to play sports again without masks and getting tested. I know no one enjoys getting that Q-tip up their nose 6 times a week as we had to in the state of Michigan. So I know that if you didn't have to do that, that would be a very exciting thing for the future. So please consider it. and feel free to follow up with us with questions. We wish you to be safe and stay well, and good luck with your seasons. We hope the best for all of you.
Next, Dr. Schaefer, any closing thoughts?
Yeah, so I want to reiterate what the commissioner had said at the beginning, that our actions really will dictate the viability of the virus. And I think we're at that crucial junction right now. And to echo what Dr. Trpkovsky said, certainly please talk to us as physicians and to anyone in healthcare to get your questions answered, have those conversations. I love, as a physician, having these types of conversations, weighing risks and benefits and deciding what is right for you. I strongly believe in each person has autonomy to make their decisions, and that's really important as you are all young adults headed into adulthood. It's very important to take ownership of your own healthcare and to make these very important decisions, and not only for yourself, but also thinking about how the vaccine will getting the vaccine will really impact how the virus is spread, and how it will impact your teammates, and also think about your loved ones. And yeah, you might not get a bad case of COVID-19, but if you can't spread it to other people, that's huge, especially for older members of the community. So I encourage you to get it, but I also encourage you to make a very thoughtful decision and to talk to your healthcare providers.
Thank you very much. And Dr. Khatri,
Sure.
closing thoughts.
So first thing is that the questions that you asked were all extremely appropriate and good questions. And I can say though that the world has come together. We're able to look at data and do analytics and computer evaluations to see how long will this immunity last? Who is it safe for? So the more questions you ask, the more the scientists will respond. That's the first thing. And just like my good friends now, Dr. Trpkovsky and Dr. Schaefer said, that the motivation for you to get the vaccination has to come from within. At the end of this, just imagine for a moment, what could you do with a vaccination that you couldn't do without it? Who is safe around you? Who can you hug? Who can you kiss? Who can you visit? Because you have a vaccination, and do it without worry than without. So just wanted to say thank you again for your time and attention, and I really appreciate the MAC conference for taking this seriously. It makes my job easier. I want to see you out there playing. I don't want to see you in the hospital or in the ICU. Good luck. I'm a Miami grad, but I'm not biased here. So just wanted to tell you, good luck, MAC conference. Go for it and get it done.
All right. Once again, we'd like to thank our three doctors, Dr. Khatri, Dr. Schaefer, Dr. Trpkovsky, for joining us to share their expertise on COVID-19 vaccines this evening. In addition, thank you to Commissioner Steinbrecher and to all the parents, student athletes, and members of the MAC for joining us on this evening's call. Please stay safe and have a great evening.